Thank you so much for joining us, Wendy. And to introduce you, you are a doctor in the sense of you have a doctorate. You are a community pharmacist. You have many other degrees, and your focus in your pharmacy work has turned to breastfeeding and medication. Would you like to tell us just a little bit more about how you came to be involved in this work?
Yeah, I sometimes ask myself how the heck I ever got into this. Part of it was I became passionate about breastfeeding when I had my second daughter, and a health visitor told me that I was good at breastfeeding. So I decided to train as a breastfeeding supporter with the National Childbirth Trust. And somebody said, well, you're a pharmacist. We have this piece of information that we need to be developed. Would you like to write it? And I sat on a 2-week locum in a homeopathic pharmacy where very few people wanted to talk to me. And I wrote 35 pages about drugs in breast milk and put my home telephone number on it, and discovered that an awful lot of people were asking questions. But I didn't have anything like the resources that I've got now. And looking back on it, it's actually quite scary. Whereas now I have 25 years more experience of answering the questions. I have online resources as well as things that just come off the top of my head now. And I get asked anything from, can I have my toenails painted, to can I have microblading on my eyebrows, to I used cocaine last night. And lots in between on postnatal depression and painkillers and things like that. So drugs and breast milk has just completely taken over my life.
And we're very grateful to have you there at the end of a helpline for that. Could I ask, what are the general principles for mothers when they are taking medication whilst breastfeeding? What are the main things they need to bear in mind?
The main thing is that anything that a drug does to you, it's likely to do to the baby. So anything that you take that makes you drowsy is liable to make the baby drowsy. So things like sleeping tablets, antihistamines like Piriton, some of the stronger anti-anxiety drugs will cross over and make the baby drowsy. But it's really important that actually the healthcare professionals know that you're breastfeeding. Through the period of COVID, I've had a lot of mums contacting me saying, I never got round to mentioning I was breastfeeding and I don't know whether it's okay for me to take or not. Or on the other extreme, saying, I didn't want to mention breastfeeding because my doctor doesn't understand that I'm feeding an 80-month-old or a 3-year-old, and I didn't want that discussion. But the overriding thing is, if somebody tells you that you can't breastfeed while taking a drug, contact one of the experts. It might be me, it might be UK Dialysis, the NHS system, but reach out for help. Don't just accept that you need to stop breastfeeding because of a medication, because 99 times out of 100 it's not true.
So with general off-the-shelf medications that parents might frequently use postpartum, things like painkillers or cough and cold medications, are there any that should be particularly avoided or used in preference?
The two things that come to my mind immediately that they shouldn't buy over the counter are the cough and cold remedy tablets or sachets, the ones that say all in one relieve all the symptoms of your cough and cold, because oral decongestants reduce your milk supply by 24% with one dose. But you can use the decongestant nasal sprays because they work just in the nose and don't get into the milk and don't dry it up. So as winter comes on, I have to remind everybody every year. And the same from the previous question, the antihistamines that are sedating, we want to avoid. Sometimes if you've got a very severe reaction, you need something to act quickly. And Piriton works very fast if you've got a large bite or an irritation. For instance, I was stung 18 times because I disturbed a wasp nest recently.
Ouch.
And I needed Piriton. Yes, it was very ouchy. I was not at all happy when they were in my hair. But I needed a rapid antihistamine to take it down, and Piriton was much would be much better for doing that. But in general, after you've had 2 or 3 doses, switch to a non-sedating drug like loratadine or cetirizine. And the other thing to watch out for is codeine. Codeine appears in the combination drug cocodamol, which is paracetamol and codeine, and appears in a lot of the migraine preparations. We no longer use codeine in a breastfeeding mother if we can possibly avoid it. It comes back to the fact that one baby died in Canada because when they analysed the baby at post-mortem, they discovered that mum had a metabolism that concentrated the codeine into her breast milk. So the baby had got multiple times more morphine, which is what the codeine had been changed into, than anybody anticipated. If codeine makes you feel sick, drowsy, or really unwell, then it's likely that you have that kind of metabolism. People like that will do anything to avoid it. But if your mother-in-law or your best friend offers you a painkilling tablet and then you discover afterwards that it's got codeine or aspirin in it, don't panic. The one dose isn't going to cause any problems. Just carry on, just don't take any more of that. So the things to avoid over the counter: decongestant tablets or sachets or liquid, codeine, aspirin, and sedating antihistamines.
Thank you. Some maternity nurses might be asked by the mums about whether they should be having caffeine or even alcohol when they are breastfeeding. Obviously, the maternity nurse shouldn't give advice, but what general information might they need to know when having those conversations?
If mums are drinking the average numbers of cups of tea and coffee in a day, it's like 3 or 4 cups of normal strength tea and coffee, that's absolutely fine, and it's unlikely to have any effect. If they're drinking double espressos 6 times a day in order to stay awake, then you might find that the baby becomes jittery and irritable. And caffeine is also in the Lucozade drinks. I remember when I had my first daughter 40 years ago being told that the bubbles of Lucozade would get in my milk and make her have gas. And that's not true. Bubbles do not get into breast milk. Possibly the caffeine might not have been such a good idea. And alcohol, the first thing I've done with all of my daughters when they've had their babies is take along a bottle of wine or a bottle of champagne to celebrate. 1 or 2 glasses of alcohol is not going to do you any harm at all. But you've probably not drunk alcohol for the previous 9 months. So 1 glass, you're going to feel fairly tipsy fairly quickly. And it takes 2 hours for each unit of alcohol to leave your system completely. But even so, the amount that's in there is really, really small. So if you're having a few glasses of wine over an evening with a meal, it's not an issue. My kind of rule of thumb is if you are going out on a girls' night out and you find yourself in the gutter, horizontal and vomiting, you should be breastfeeding. In fact, you should actually be looking after your child that night. And in an ideal world, we would be saying pump and dump your milk. But if you've got that kind of hangover, you're not going to be pumping and dumping milk. But if you did pump and dump your milk, it actually works really well to redress the symptoms of the hangover.
That's very useful. And would it be the pumping and dumping because at that point mum needs to relieve some engorgement, and that milk would be high in alcohol content, but if she were to simply wait and feed her baby later, that the alcohol in her breast milk would go down in line with going down in her blood? So it's not the dumping that gets rid of it. The dumping we're doing because we're engorged, and at that point the alcohol level is quite high. But if she did not need to pump and dump because she wasn't engorged and fed a few hours later,
it's a two-way thing. As it
reduce.
Yeah, as you drink, it goes into your milk, but as the level in your bloodstream comes down, it comes back out of your milk supply again. So it's not stuck in there. You don't have to pump to clear it. It will just dissipate back again. As you say, it's just to relieve the engorgement and maintain your supply.
Lovely. So obviously we want all mums to get really good advice, but I'm sure you have similar experiences to me in that not all healthcare professionals know as much about breastfeeding and medications as we might like. What could a mum do if they feel they've had poor advice, or they're not sure that advice from a healthcare professional is quite right for them? Where might they be able to go for more advice?
So that's the predominance of the messages that we get on social media to the Drugs in Breast Milk service. People just not feeling quite comfortable and often being told, well, you just need to stop breastfeeding in order to take this drug. I have at least 2 today that say, I need an antidepressant, and I've been told that I have to stop breastfeeding in order to have an antidepressant, and that's just not true. So a bit like at the beginning, if you're told to stop breastfeeding, contact somebody and discuss it first before you make that decision. But once you've got that information, it would be really good if you could take that back and share that with the healthcare professional. And I often suggest that mums contact the practice manager of the doctor's surgery and say, in a positive way, Dr. So-and-so tried their best to help me, but I think they need to update their knowledge about so-and-so, and provide some information. And there's actually a lot of training that I put on my website, Breastfeeding and Medication, so that the GPs actually are able to update their knowledge about how drugs get into breast milk and why it's important.
And there's an excellent book we could recommend.
So we want to come away with it being a positive. Sorry, is there a book that I would recommend? Yeah, funny enough, there is a book called Breastfeeding and Medication.
There is.
So within the next 24 hours will be a book called Breastfeeding and Chronic Medical Conditions, which I am just finishing and is going to be available on Kindle. So for all the additional mums that I've seen over the last 25 years who are breastfeeding despite dealing with ongoing pain every day or mental health issues or so many different things, people who years ago would have been told it's not good for you to have a baby, are having babies, raising them and breastfeeding. But we want them to be able to manage their condition as well as their breastfeeding. So that's been my project over lockdown.
Fantastic, much needed. So what sort of medications would indicate that stopping breastfeeding is best? You said, very high percentages of medications you can breastfeed through. What sort of things might be those very different circumstances where actually the general consensus of advice would be stopping breastfeeding is now a priority for maternal health?
There is such a few of them, and the one that comes to mind immediately is chemotherapy, where the mum has been diagnosed with a form of cancer, and the chemotherapy drugs are going to be too toxic for the mums. But actually, I get messages from a lot of people who say, it's really important to me that I can go back to breastfeeding. So they pump and dump for the duration of their chemotherapy, plus the period afterwards when the drug is still in their bodies, and then go back, if they feel able, to breastfeeding again afterwards. And for some people, that's really important, about taking control of their bodies again and making them work. Another drug is lithium, which is used for bipolar disease. It is in theory possible to breastfeed on it, but the baby needs monthly blood tests as well as the mum to check for various factors. And these results have to be monitored by a paediatrician. And really sadly, I've never found any healthcare professional that was willing to take that responsibility. And that's kind of quite sad. And I keep coming back to codeine. We have alternatives to codeine now. Although dihydrocodeine sounds very similar, it's changed in the body in a very different way and is safe and compatible with breastfeeding.
So dihydrocodeine would be an optimal drug for postpartum women if they needed that additional pain relief from paracetamol and ibuprofen.
Yeah, and no mother should ever be left in pain just because she's breastfeeding. I hear so frequently people being told, if you insist on breastfeeding, then there's nothing else I can do. Well, that's just not true.
Very good to hear. So to sum up, Where can people, maternity nurses, go with their clients to look for more advice? Obviously, we're talking to you today, but not everybody can talk to you every day. So where are the sources of written advice that people might be able to go and helplines that they might be able to approach?
So on the Breastfeeding Network website, I've produced, I think it's 60 odd fact sheets of the most common medical conditions, anything from threadworms to constipation to painkillers and depression. So there should be an answer there. If it's not clear, then there is a social media page that you can message directly onto. We're hoping over the next 6 months to widen the number of people that is available for answering those questions. At the moment, there is only 2 of us, and it gets a little bit demanding when we've been taking 10,000 messages a day. So Breastfeeding Network, drugs in breast milk fact sheets. I've also put some other fact sheets on my website, Breastfeeding and Medication, on things like termination, on cocaine, on anesthesia, all the more unusual ones which I've often taken out of my book. And everybody can also use the free online database called LACTMed, LACTMED. And that's free for everybody to access. But it may be that that's just a bit too complex to read, and you need somebody to just help you interpret that. And that's when we're always happy to be available. So you can message via social media, or you can email as well.
Thank you, and we will put those details up on a slide at the end of this. Thank you so much for your time. That's been hugely informative. And we know that this information is going to really help maternity nurses to help new mums when they most need it. So thank you very much indeed.
My pleasure.